Hi, everyone. This is Dr. Blaise Aguirre. I'm a psychiatrist at McLean Hospital, and I've been getting a lot of questions from friends and other people asking me if I have some general ideas about how to deal with specific situations during this very difficult time that many people are experiencing. So they sent me questions, and I'm going to answer these with some ideas that are derived from the treatment that I use, and that is known as dialectical behavior therapy, or DBT. So for many people who don't necessarily want to be around their family, they will just avoid their family and go to their room and avoid being with them. And then at other times, the right thing to do is to say, I just need some space. I need some space from my family. It's just a little bit too much. So what I'm going to do is I'm actually going to spend some time in my room and read a book, take care of myself in that way. So how can you tell the difference between avoidance and legitimate self-care? The purpose of avoidance for many people is to not get more upset and not have to deal with some difficult interaction that is present. Here, what you have to do is you can do this through the practice of mindfulness or self-reflection or self-assessment, and recognize the intention that you have for leaving the situation. Are you doing this simply to avoid being connected? Are you doing this simply to avoid having any kind of conflict and not dealing with it? Or are you doing this with the intention of taking care of yourself? You will know this for yourself. Another person can't know if you're avoiding or not avoiding. Now, one of the tricks to deciding whether you're avoiding or not is, do you go back and address the situation that you're avoiding in the first place? If you don't go back to it, then you were avoiding. If you do go back to it, then maybe you were taking good care of yourself. So the important distinction is to recognize what the intention is in the moment. How do you keep OCD, that's obsessive compulsive disorder, and hypochondriasis under control? This is a trickier question because for some people who have OCD, and especially who are phobic of germs and spend a lot of time washing their hands, the recommendation is that people wash their hands. So how do you keep that in check, being told to wash your hands, when at the same time deal with the compulsion to wash your hands? Again, this is where a self-assessment and introspection is going to be very important. Washing your hands because that's the recommendation, and washing it for 20 seconds with warm water is one thing. Washing your hands repeatedly for hours, because that's part of an OCD diagnosis, is a completely different matter. And for people who have successfully navigated OCD treatment and are no longer repeatedly washing their hands, for example, there's a danger of slipping back into old behavior. And I think that doing something like having a timer in the bathroom and just sticking to the 20 seconds would be important. Agreeing to only do it once an hour, or maybe twice an hour maximum, would be important. Knowing why you're doing this, so that the reason you're doing this is to follow guidelines versus as part of a compulsion. Similarly, with hypochondriasis, is that we know that when people get anxious, there can be physical manifestations of the anxiety. So there can be headaches, there can be stomach aches, there can be neck tension, and there might be a desire to have frequent doctor visits. There can also be a worry that every time you cough, that it might be a manifestation of COVID. So again, doing a self-assessment saying, okay, I was feeling okay this morning, and now I'm noticing stomach ache. Um, Maybe that's part of anxiety. I had a cough, but I don't have a fever. I'm not sneezing. I don't feel ill. Um, that I don't think that I need to go and get checked out. So know yourself. It's going to be very important to know yourself and to know the distinction between what is a new symptom versus what's part of an old pattern or an old worry. And now this is difficult. This is difficult to do because we are so worried. But the more we can relax under these conditions, the better we're going to be able to assess uh, the distinction between what is worrisome new symptoms and what's a pattern of old behavior, like in OCD or hypochondriasis. The next question is, how do you stay on top of overall wellness? Our tendency when we're um, more isolated and uh, not active is to maybe lie on the couch and watch TV all day or sit in front of our screens. But this is definitely not a path to wellness. So get a schedule, and I would add to the schedule, I would add 3 meals, and I would make sure that these are balanced meals. So make sure that you're getting enough proteins, fats, and carbohydrates, vegetables, not too much sugar. I would make sure that you're limiting screen time. I'm seeing a lot of people spending the entire day watching the news channels and every new case of COVID. So limit yourself to maybe a couple of hours, maybe once in the morning and once in the evening. Uh, Make sure you get some exercise. One of the people that I know decided that what they were going to do is to run a marathon. And what they did is they ran around their garden until they reached 26.2 miles. That might be excessive. But if this friend can do that, then you can do sit ups, you can do squats, you can do jumping jacks. And maybe if there are other people in the house, you can do that with them. Make sure you get enough sleep. And this is a difficult time for many people because they're worried. And so have a routine. Go to bed, whether it's at 9, 9:30, 10, 10:30, 11, whatever the time is, make sure that you're doing that every night. And it's very difficult for people to sleep. So practicing good sleep hygiene, maybe listening to relaxing meditations, um, uh, doing some paced breathing to reduce your anxiety before you go to bed, and good sleep hygiene is going to be important. So these are just some ideas to maintain general wellness during this time of being stuck at home. For many people with depression, one of the things that they tend to do is to isolate. And this is a time when we're being asked to socially distance or socially isolate. There's a skill in DBT, and we call it opposite action. And that is that the brain learns new behavior by doing things differently from what it's done before. So if during times of depression, what you've done is gone into bed and covered your head with your duvet or your sheets, to really do the opposite of that. Now, it's difficult to do because you can't go outside and go for a walk in the park, and a lot of entertainment places are closed down. But you can still use social media, and this is one situation where I really recommend it, through Skype, through Zoom, through WhatsApp, through FaceTime, and any other interaction that you can have to reach out to the people that you love, maybe reach out to people who you haven't spoken to in a while, and really stay out of your room. Be in a sunny place where you can get a lot of sunlight to the extent that you can, and do the exact opposite of actually staying in bed. I know that this is a difficult thing to do for many people, especially when they're depressed. But for many people who are depressed to stay in bed, they know that staying in bed doesn't actually improve their depression. Another question that was asked is, how do you deal effectively with conflict with the people in your immediate environment, with irritability, with increased fighting? The idea that under most circumstances a person is doing the very best that they can do is an important one. And that is that under these conditions, it's probably not in their interest to make your life even worse than it is. And it's not in their interest to make their own life worse than it is. So I think it's giving each other the benefit of the doubt. One of the things that we use in dialectical behavior therapy is the stop skill. The stop skill stands for S, is to literally stop what you're doing. So if somebody is irritable and they're asking you to do something that seems unreasonable and all you want to do is bang back and yell at them, is to stop. The T stands for anything that's going to take a pause, take a few breaths, take a 5-minute break, take some time to relax, to regulate. It might be 10 minutes that you need. Then the O stands for to observe mindfully, and that means to notice what your urge is, to notice whether your acting on your urge is going to be the effective thing to do. And then the P is to proceed mindfully, meaning that what is the action that's going to be most helpful in this situation? And sometimes the best action is just to do nothing. But sometimes there is something that you can do. And also, by doing this, it's also going to model for the other person more effective ways of doing this. Not only will this help the interpersonal relationship, but it will also help you. The next question I received is a question about judgment and how do you interact with people who are making decisions that you wouldn't make in the current situation, and especially when strong judgments arise within you about their decision making. This can be very difficult because there might be many people who are making the same kind of decisions as you are, and then you see TV images of people on beaches, maybe not washing their hands, etc. The question is, what does the judgment do for you? Simply saying to someone, you're being irresponsible, you're being stupid, you're being thoughtless, doesn't tend to change their behavior, and in fact can lead to increased conflict between you and the other person. So the task here is to get curious. They're making certain decisions and so are you. If you want them to change their behavior, being curious about why it is that they're doing what they're doing is more likely to change their behavior than just yelling at them or simply judging them. We don't know exactly why people are making decisions that might be unhealthy or unhelpful, but being curious first is a step forward. That doesn't mean that you're going to like the decisions that they make, but at least you'll have more information about doing that. Now, there's a difference between being judgmental and just assessing or deciding that what they're doing isn't healthy or helpful. But judge the behavior if you're going to do some judgment and not the entire person. Because the other thing that can happen is that because a person decides not to wash their hands, that they are then, quote unquote, a terrible person. But remember that the judgment is of the behavior and not of the person as a whole. So be curious as a way to counteract being judgmental. And if you use the stop skill, slowing yourself down before banging back and interacting with the person in an adversarial way, and then asking them about their behavior is more helpful in reducing judgment.